Ever wondered what happens in a simulation lab admission process? Today we delve into the intriguing world of sim lab admissions. Simulation labs, or sim labs for short, are an essential part of modern medical training. They provide a safe, controlled environment where students can practice their skills and decision-making abilities without any real-world consequences. Now you might be wondering, what does a simulation lab scenario look like? Let's consider the Thao visit number 7 scenario, a post-operative colon resection case. This scenario allows students to navigate the complexities of post-operative patient care, honing their clinical judgment and communication skills. These simulation labs are more than just a learning tool. They are an immersive experience that prepares medical professionals for real-life situations. The relevance of these simulation labs extends beyond the classroom, shaping the future of patient care. Ready to uncover the steps of the sim lab admission process? Stay tuned. Now that we've set the stage, it's time to walk you through the sim lab admission process. This is a journey that transforms medical students into confident healthcare professionals, ready to face real-life scenarios. The first step in the sim lab admission process is registration. Here, students are required to provide their personal details, course information, and other relevant documents. This step is crucial, as it sets the tone for the entire training experience. Next, students are introduced to the simulation lab environment. This is where they get acquainted with the state-of-the-art technology and equipment that they'll be using throughout their training. The lab is designed to mimic real-world medical settings, such as hospitals or clinics. This exposure is invaluable in preparing students for their future careers. Once the students are comfortable with the lab environment, they proceed to the pre-briefing stage. This is where they receive detailed instructions about the simulation scenarios they will encounter. The pre-briefing is essential, as it prepares students for what's to come and allows them to strategize on how they'll handle the scenarios. The simulation exercise is the core of the sim lab admission process. Here, students get to apply their theoretical knowledge in practice. They work through various scenarios that mimic real-life medical situations, with the aim of enhancing their decision-making and problem-solving skills. After the simulation exercise, a debriefing session takes place. This is a reflective process where students discuss their experiences, receive feedback, and learn from their actions. The debriefing session is a crucial part of the learning process, as it helps students to understand their strengths and areas that need improvement. The final step in the sim lab admission process is evaluation. Students are assessed based on their performance during the simulation exercise and debriefing session. This assessment helps to determine whether they're ready to move on to the next level of training, or if they need further practice. So, that's what happens behind the scenes in a sim lab admission. Intrigued? There's more to come. Now that we understand the sim lab admission process, let's delve deeper into a specific scenario, the Thao visit circumflex N7 scenario post-op colon resection. In this scenario, Thao represents a patient who has just undergone a colon resection surgery. The scenario starts from the moment Thao is admitted into the simulation lab for post-operative care. The complexity lies in the fact that every patient, including has unique needs and challenges post-surgery. Here the focus is on careful monitoring of vital signs, managing pain, and preventing complications such as infection or bleeding. It also involves assessing the patient's recovery progress, which includes monitoring bowel function, incision healing, and overall well-being. In the broader picture of sim lab admission, this scenario is significant because it presents a real-life situation that nurses and medical practitioners may encounter. It tests their skills, knowledge, and decision-making abilities in a controlled environment. As a learning tool, the Thao visit circumflex N7 scenario post-op colon resection provides invaluable experience. It allows students to learn from their mistakes without any real-life repercussions, and to improve their clinical judgment and patient care skills. And there you have it, a comprehensive look at the sim lab admission process and the Thao visit circumflex N7 scenario post-op colon resection. Exciting, isn't it? Intricate, challenging, and absolutely vital for medical training. That's the sim lab admission process for you. As we've seen, each step in the process is crucial, from the initial admission to the detailed analysis of specific scenarios, like the Thao visit circumflex N7 scenario post-op colon resection. The complexities of these simulations only underline their importance in preparing future medical professionals for real-world challenges. So let's continue to appreciate the role of these invaluable learning tools in medical training. Thank you for joining us on this fascinating journey into the world of sim lab admissions. Until next time, keep exploring and keep learning.